Brett Shamosh, CEO of CareDox. Brett, happy to have you. Grab your microphone. I understand CareDox is on a mission to improve children's health by really making the school a hub of care, which I think is really, really cool. So I'm really happy to have you here. For our interview, you know, we like to start with that big picture question, sort of the why question. So what's that big health moonshot that CareDox is going after?
Sure. So at CareDox, we want to ensure that every family in America has convenient access to quality care for their children at all times, and it's absolutely possible.
Yeah. So why are schools so important to that equation?
Well, so we have this organized system in this country that understands the needs of our kids' health at all levels. They understand the social determinants affecting these kids' health. They understand that they have great relationships with the parents and guardians of our children, and that's an untapped resource. I'd argue that it's actually the largest pediatric health network in the country. And so what we're aiming to do is to provide this health tech infrastructure. We have our EHR in 2,600 schools across 31 states in the country.
Wow, that's a lot.
And we can connect that to the services so that these kids get the care they need at the time they need it.
Okay. So that's the big picture, that's the health moonshot. What are you building? Describe that network and how that actually works on a day-to-day basis in a school.
Yeah, so our children are going to the school nurse office 5 to 10 times during the course of a year. All sorts of things are going on with their health. So 10-year-old Mary is having exacerbations of her asthma, and she's going to the school nurse 3-4 times in a month. And there are all sorts of things going on at home. Mom doesn't have a car, there's a cat at home. And so there's managed Medicaid services that are funded to the tune of $89 billion a year across the country for cases like this. And so we connect that intelligence to the managed Medicaid organizations so they can provide those services, and they can reach out to the families and coordinate with the school nurse to get the care that the kids need.
Yeah. Is this a passion that's personal for you? I mean, a lot of people are connected to children's health, and it can be very, very personal. So,
yes.
So kind of what does this mean to you?
Well, I have 2 kids, a 10-year-old, 11-year-old, and 11-year-old that is a grade above my other 11-year-old, and they're in the school nurse office, and I am very fortunate to get those updates and be on top of my kids' care. But many families across the United States are working multiple jobs. Both families are working. They can't be as on top of it and can be connected to the convenient services. And so I'm pretty passionate about making that happen.
So this infrastructure that you're building is in thousands of schools currently. Let's talk about traction. What you're excited about coming out of 2019 into 2020, what we can be expecting from CareDox.
Yeah. So in 2020, we have recently signed with soon-to-be largest Medicaid MCO on the planet, Centene, upon their acquisition of WellCare, and we're going to launch with them in Indiana and California to provide services to kids through the school system and through this intelligence network. So we're really excited to prove that.
Why is that collaboration important specifically?
Because they have a lot of funds to provide these services. In fact, they're obligated in many instances through MLR, medical loss ratio, to provide upwards of 85% of their revenue in the form of services. They're wonderful services, free cell phones, free chronic disease management, all sorts of programs. They just need to know who needs the care and at what time. And so we're able to provide that intelligence and work with them to get the kids the care they need.
Okay. If you were speaking to like a school nurse, like paint me a picture of how dealing with a child situation would be different with this kind of infrastructure.
Yeah, so
my mother-in-law happens to be a school nurse, and so I think about her and improving her life, kind of making it very practical.
Yes. Where is she a school nurse?
In Pennsylvania.
Okay, so she may be using our software. We'll have to talk after. But you know, these school nurses want to have convenient software to understand who are the frequent flyers, what are the care programs recommended by the parents or the care provider of that kid. They want to understand what they should do for discharge, so there's clinical decision support baked in, and it makes their lives a lot easier to be able to give the kids what they need with our electronic health records.
Awesome. Brett, that's all the time we have.
Great.
Thanks so much for coming. I hope this is an awesome few days for you at the conference. All right, take care.